Today we are performing cataract surgery in Nika, a harbor seal at Utah's Hogle Zoo. So she's a relatively young animal. She's around 13 or 14 years of age, and seals can live up to 40 in human care. The right eye was clinically blind, like no light couldn't get in, there's no way for her to see out. The left eye had gotten to the point of 100%. And the problem with cataracts in pinnipeds, or seals, sea lions, and walrus, is that they get loose over time and fall forward and damage the eye further.
So today, elective procedure on a harbor seal, and we had to do anesthesia because they don't understand what we're doing. There's some things we can get away with sedation and communication in humans, but the seals don't know that we're actually on their side helping them. So anesthesia or unconsciousness is needed. So anesthetizing a seal isn't the same as anesthetizing a human. One, it's the same thing that pediatricians have to deal with, communication. They don't know what we're doing. So we have to come in with drugs to help modify behaviors. With a seal, it's a little bit harder to get in the blood to give a drug, to give an IV intravenous injection compared to a human, because they don't have appendages that have easy accessible veins. You can't just grab their arm, find a vein and stick it. So our access to their inside of their body is harder, and then our monitoring equipment's mostly made for humans. We have to adapt it to work for the seals. Animals that naturally hold their breath for long periods of time tend to do that when sedated. That's where companies like mine are coming in, trying to build equipment that's for these species to do a better job.
As soon as you enter an eye at all, you create inflammation. So for about a week before, we already had her on these eye drops to get her ready, and then we gave her a mega dose numerous times to further diminish the inflammation. So inside the eye, you have the cornea, which is your windshield, and so that's the first focusing part of your eye. And then you've got the iris, which is like your aperture of your camera, letting light in and out. And then behind there's a lens, and the lens is basically like a peanut M&M that's clear. So you've got the peanut, the chocolate, and the candy coating. And what that does is it focuses light as well onto the back of your eye, called the retina. And what it does is it takes that image, takes it to the brain, magical things happen, and then you can see. So the traditional cataract surgery involves dilate the pupil so that you're able to see the entire lens. You make a hole in the candy coating of the front of the M&M, and we have a special machine, which is basically a needle, and it vibrates with ultrasonic power, and it breaks up the chocolate and the peanut, if you will, of the cataract, taking it all out, leaving the candy coating intact, which should then be relatively clear, and then we'll actually implant a fake lens so that they can be 20/20 again. The difference in a pinniped is that the lens itself is very hard. It's impossible to break up that cataract unless they're babies. And so what we have to do is physically take the cataract in its entirety and then take out the candy coating, because if we leave the candy coating, it will opacify within a year and make them blind again. The reason they don't need a lens implant doesn't mean that they don't focus at all. In fact, their corneas have an innate flattened area that works to focus incoming light to the back of their eye, totally bypassing or not needing the lens for its function. It's amazing, like right after surgery, once their wits are about them, their anesthesia's kind of worn off, they typically can target, they can do hand commands, they can do the things that they were trained to do.
Nika started training and eating the next day after surgery. So we were a little surprised, and we credit that a lot to all the training we did beforehand and all the preparation that we went through. Nika had cataract surgery in both eyes. To allow that to heal, she was not allowed in the water. She had to stay dry, which is really hard for seals since they're used to being in the water. We had to do lots of drops many times a day to help get medication into that eye. So even people after cataract surgery have to get a certain number of drops. So with Nika, we had up to 5 different kinds of drops, up to 4 times a day. So to keep that all straight, we made a whiteboard and we color-coded each drop. These helped the eye heal, and each drop had a different purpose. Some helped with inflammation, some was an antibiotic. So depending on the drop, she had to have that at different times. We just got very organized, and that's something that we've continued because she will be on eye drops for the rest of her life. She's on exhibit now. She's been a great patient. She still is a great patient. She's great with our vets when they still come out. We haven't seen anything negative that has come from her surgery. If anything, our relationship with her is amazing. It's better than ever.